Hello everyone. Today we will see the Stevens-Johnson syndrome. So the Stevens-Johnson syndrome is a rare, serious disorder of the skin and mucous membranes. It's usually a reaction to medication that starts with flu-like symptoms, followed by a painful rash that spreads and blisters. Then the top layer of affected skin dies, shades and begins to heal after several days. Stevens-Johnson syndrome is a medical emergency that usually requires hospitalization. Treatment focuses on removing the cause, caring for wounds, controlling pain, and minimizing complication as skin regrows. It can take weeks to months to recover. A more severe form of condition is called toxic epidermal necrolysis. That's the TEN. It involves more than 30% of the skin surface and extensive damage to the mucous membranes. If your condition was caused by a medication, you will need to permanently avoid that drug and other like it. Symptoms: 1 to 3 days before a rash develops, you may show early sign of Stevens-Johnson syndrome, including fever, a sore mouth and throat, fatigue, burning eyes. As the condition develops, other signs and symptoms including unexplained widespread skin pain, a red or purple rash that spreads blisters on your skin and the mucous membrane of the mouth, nose, eyes, and genitals, shading of the skin within days after blister forms. When to see a doctor? Stevens-Johnson syndrome required immediate medical attention. Seek emergency medical care if you experience signs and symptoms of this condition. Drug-induced reaction may occur during the use of medication or up to the 2 weeks after discontinuing it. So here are some causes. Causes are: Stevens-Johnson syndrome is a rare and unpredictable illness. Your healthcare provider may not be able to identify its exact cause, but usually the condition is triggered by medication, an infection, or both. You may react to medication while you are using it or up to the 2 weeks after you have stopped using it. Drugs that can cause Stevens-Johnson syndromes, including anti-gout medications such as allopurinol, medication to treat seizure and mental illnesses as anticonvulsant and antipsychotics, antibacterial sulfonamides, nevorapamine, pain relievers such as acetaminophen, ibuprofen, and the naproxen sodium. Infections that can cause Stevens-Johnson syndrome, including pneumonia and HIV. Risk factors that increases your risk of developing Stevens-Johnson syndrome, including first, an HIV infection. Among people with HIV, the incidence of the Stevens-Johnson syndrome is about 100 times greater than among the general population. A weakened immune system can be affected by an organ transplant, HIV/AIDS, and autoimmune disease. Second one is a cancer. So people with the cancer, particularly blood cancer, are at increased risk of Stevens-Johnson syndrome. Third, a history of Stevens-Johnson syndrome previously. So if you have had a medication related form of this condition, you are at risk of a reoccurrence if you use that drug again. Fourth, a family history of Stevens-Johnson syndrome. If an immediate blood relative has had Stevens-Johnson syndrome, you may be at increased risk of getting too. Fifth, genetic factors. So having certain genetic variations put you at increased risk of Stevens-Johnson syndrome, especially if you are also taking drugs for seizures, gout, or mental illnesses. Complications: Stevens-Johnson syndrome complication includes: first is a dehydration. Areas where the skin has shed loose fluid and sores in the mouth and throat can make fluid intake difficult, resulting in the dehydration. Second is the blood infection, that's a sepsis. The sepsis occurs when bacteria from an infection enter the bloodstream and spread throughout the body. Sepsis is a rapidly progressing life-threatening condition that can cause shock and organ failure. Third, eye problem. The rash caused by the Stevens-Johnson syndrome can lead to eye inflammation, dry eye, and the light sensitivity. In severe cases, it can lead to visual impairment and rarely blindness. Fourth, lung involvement. The condition may lead to an emergency situation in which the lungs can't get enough oxygen into the blood. It may lead to the acute respiratory failure. Fifth one is permanent skin damage. When your skin grows back following Stevens-Johnson syndrome, it may have bumps and unusual coloring, that's a dyspigmentation. And you may have scars. Lasting skin problems may cause your hair to fall out, and your fingernails and toenails may not grow as well as they did before. Prevention. Consider genetic testing before taking certain drugs. The Indian Food and Drug Administration recommended screening people of Asia and South Asian ancestry for the gene variation called HLA-B*1502 before starting treatment. If you have had this condition, avoid the medication that triggered it. If you have had Stevens-Johnson syndrome and your health care provider told you it was caused by a medication, avoid that drug and others like it. This is key to preventing a reoccurrence, which is usually more severe than the first episode and can be fatal. Your immediate blood relatives also might want to avoid these drugs because sometimes this condition runs in families.